Dr. Miller here, and I've received another question about what is the difference between functional medicine and biohacking. There is a difference, and that difference has a lot of overlap, but they're very similar. As a matter of fact, in functional medicine, we can use a lot of biohacking. So, some examples of biohacking is using an aura ring to track your sleep so that you optimize sleep. We use that with a lot of our patients so that they can start to see where they are breaking down. Sleep is one of the first things that I actually started to address in myself because I was not getting enough sleep to allow my body and my hormones and things like that to come back online to help me heal and be healthy. So, what is biohacking? Well, biohacking is kind of do it yourself biology. It combines nutrition, it combines lifestyle, technology, self tracking to help you live longer, think sharper, and overall expand your experience as a human using these types of technologies and things so that you can, well, optimize life. And not only, it's hard to quantify if you're extending life, but we can absolutely quantify whether or not we are keeping our health span, meaning we're able to actually perform the way that we want to perform. The perfect case in point was I saw some people trying to bend over and they were the same age as I was. And as I was watching them bend over, it was very eye opening to me as the difference because I can bend my knees, squat, and pick things up. And they couldn't do it. And so when I see that, I know that there's a difference in the way that we treat ourselves and treat our bodies. And this starts to actually differentiate. I had a great analogy with a patient just recently. It's kind of like your retirement. If you don't go in and save money from a very early age, then the closer you get to retirement, the more that you have to do to make sure that you're safe and have enough money at the end of your life that you can leave something. Once again, it's better to have excess and leave some than it is to have nothing at all left over. So, how, let's just start to look at the ways that biohacking and actually even functional medicine overlap. The first thing is we want to start to talk about improving cellular function. We want to take that basis of life, which is the cell, and we want to take that cell, make that lipid membrane around the cell, and we can measure this. We can measure this using phase angle. How healthy is that? Because the healthier the cell is, the healthier you are. And so we want to optimize cellular function. We actually want to take that little blue dot in the middle there. That is the mitochondria. And we want that mitochondria to be healthy, to produce energy, that's the nucleus, actually the mitochondria. We want to take that mitochondria down there that produces your energy, and we want the nucleus and the endoplasmic reticulum. We want these things to actually be healthy and optimize and doing everything that they can for you so that you have the energy you need to exist. You have the energy that you need to run your immune system, which is a very expensive system to run. If your immune system is always activated, you are putting such a drag on your body. But you got to have it for the immune system, the hormone system, musculoskeletal system, the brain, the cardiovascular system. You need energy. The mitochondria and the cell needs to be healthy for that. And so we do things like looking at what is your omega-3 content. The omega-3 content overlaps in the cardiovascular arena. It overlaps in the cellular arena. It overlaps in the neurological arena. We want to know what that is and we want to optimize that. so that when you are living your life, you minimize the risk of problems that are going to happen. And so that's both biohacking and in functional medicine. Next, start to think about the brain. And so, as I was talking about earlier, when we were talking about sleep and sleep optimization through like tracking with a Whoop or an Aura or whatever the case may be, the brain requires shutdown. That's why sleep is so important. In the brain, when you go to sleep, the glymphatic system starts in that deep sleep, which is first that REM, that first cycle of sleep is deep sleep. And that opens up the glymphatic system and it starts to flush the brain out. And then you go through the stages of sleep, but we also want to optimize that. And how do you optimize brain function? The brain uses 25% of your glucose per day. So um, it's a very hungry component of the body, especially for how small it is. So when we look at that, the brain is primarily made of fat. So once again, back to the omega-3s, back to, are you getting good sources of fats in raw, unsalted nuts? Are you getting good sources of fat through avocados and the things that you eat? We're a very protein-centric society. Actually, we're a very carb-centric society. As people become healthier, they start to think more about protein, but we can't forget the fat because the fat actually helps with the brain. It also helps with the hormones. Once again, it also helps with the neurology. So the nerve itself is like a filament in segments. And then there are these globules of fat that are the insulation that go around that filament. You have to have healthy fats so that these things can work efficiently. So in functional medicine, we use biohacking techniques to calm the nervous system down, to stimulate the vagus nerve. You can start to think about using nootropics, whatever it may be, from mushrooms to whatever the latest, greatest potion is. But those things, giving your body more of them, more meditation, more neurofeedback, more good nutrition, those are the biohacks that functional medicine uses to improve neurocognition. As we look at that neurocognition and we go back to sleep, what do we know about the eyes? Well, the eyes take in all wavelengths of light, and we know that the blue wavelengths of light stimulate the SCN, suprachiasmatic nucleus. That also helps us regulate to circadian rhythm. So we use like blue light blocking glasses if you're always on screens and doing that stuff because that's a lot of blue radiation. We also use things like it's an app. It goes on the computers. I can't think of it right now, but basically, if you have an Apple device, you turn on the circadian rhythm part of it, and it'll start to change the wavelength of light on the actual iPhone or iPad. If you have a computer that runs off of Windows, there's an app that you can install that tracks what time it is, and then it changes how cool your monitor is. And when I say cool, it's not cool as in, oh, something's bad. It's cool as in we change the wavelength of light so that you don't get the stimulation that actually keeps you up. When we're looking at this stuff, you've got to pay attention to like what I say, when you sleep. Money time sleep is between 10 and 2. You want to make sure that you are absolutely sleeping in between those times so that you get the most out of it and you get the most out of it for your brain. Next, in the biohacking realm, we start to look at things like balancing hormones. So a lot of people in biohacking use things like peptides and hormones, as do functional medicine doctors. And we want to make sure these things are balanced. That's one of the great things about actually both communities. Both communities believe in that balance, number one. and then they want to help you get to where you control that in and of yourself. So once again, this is another place where there's overlap between biohacking and functional medicine. Biohacking tends to use herbs and things of that nature a little more than like functional medicine does. But once again, they're going after the same goal, and that's to optimize your hormones, your neurotransmitters, and your metabolism. Functional medicine addresses metabolic concerns, but they don't go after it as aggressively as the biohacking community does. As we're on the metabolism thing, as a functional medicine doctor, and I want to work on metabolism with people, I don't just tell them, hey, go do XYZ. Actually, I do the things that help with metabolism. I do the clean eating foods, and we give people lists of that. We try to eliminate environmental toxins as much as we can. We do the cold plunges. We do breath work. These are all things, these are all tools that we use as functional medicine doctors that are in the biohacking realm because the two things work very synergistically. And that all works towards your benefit. So those are things that we help teach you. But you can go in and how to biohack your sleep and how to biohack whatever it is. End of the day, as we're in the hormonal section of this, better hormonal balance equals better health, better mood, better longevity, to the point of the hormones. When we start to look at the cell again, estrogen affects how the outer lipid membrane of the cell, the quality of that. So even guys have to have enough estrogen, not only to keep hair and stuff like that and skin, but also how to keep the cells healthy, because that's very, very important. Cellular health, mitochondrial medicine are very important to your health and longevity. Functional medicine doctors are what they call inflammologists. We are always looking for the source of inflammation, and then how do we help the patient deal with those sources of inflammation. So if you slow down inflammation, inflammation is also called inflammaging. And the biohackers want to stop aging, reverse aging. A famous biohacker by the name of Dave Asprey says he's going to live to 180 years old. No, we don't have the technology to do it now, but he is hoping through his life that these advancements will come. I want to live a very long and productive life. So I start to look at the things that age my body and I start to take those out. Now, where biohackers start to go in and they want to use infrared sauna and anti-inflammatory diets, and they also use supplementation. These things are all interrelated to what functional medicine doctors do or use also. Once again, this is where functional medicine and biohacking are interlinked. A lot of doctors, for me, biohacking and functional medicine are one and the same. They're the tools that I use to help people. A lot of doctors don't do that. They will use one tool like supplements, or they want to use just nutrition. It's not that simple. There's just not one lever. You want to pull all the levers. So as I discuss this, it's going to be a little different than if somebody else who is just in the biohacking community. I want to use whatever gets you the healthiest, the fastest. And so, being less inflamed reduces the rate at which you age. And so there are ways to measure this. We can do a telomere test. We can look at how long the telomeres are on the end of the DNA. If those telomeres if they aren't healthy and they aren't long, then there are things that you can actually do that will help lengthen those. And that's very important for your longevity and your ability to be productive as you age. Next, we're going to talk about enhancing immunity and disease prevention. As I said earlier, the immune system is a very expensive system to run in the body. So, biohacking wants to use like cold exposure, whether it be the Wim Hof method or it's cold plunging or whatever else. That actually puts a stress on the body and allows old cells to actually break down. There's two types of cellular destruction, autophagy and apoptosis. Autophagy typically happens first, and apoptosis happens especially on a prolonged fast. The body will actually break down or tell cells to die. Cancer cells, things of that nature are very actually fragile because they actually expand and grow so fast that they are actually very susceptible. Not saying that it cures it, but this is one way that the research and the literature shows that if you're fasting, you can actually start to kill off cancer cells because they need insulin and glucose to grow. Cold exposure causes some of that. Vitamin D optimization, we can't call vitamin D a vitamin. It's actually a hormone, prohormone. And you have to have that. And you generally want to make sure you're getting enough K2 with that. That helps regulate the immune system. K2 helps the body take the calcium out of the blood vessels so that they don't harden. And the typical American, standard American diet is very low in K2. So I supplement with that. And actually, all of my functional medicine patients supplement with that. If you're on a vitamin D that doesn't have K2, or if you're taking a bolus dose of vitamin D, you probably aren't having enough K2. And bolus doses don't don't have, they have effect. Are they optimal? Not typically. So we want to optimize that. We want your body that when it needs to fight, it has what it needs to fight. But when it needs to shut down, we need to be able to turn the immune system off. And that is all kinds of stuff. That's your hormones. Do you have enough polyphenols and bioflavonoids to run the cellular health that causes the immune system to shut down? Are you getting enough of the polyphenols and bioflavonoids in your body to make the short chain fatty acids? There is a lot to that. Gut health is very, very intertwined with that. And so as we look at in my office, biohacking and functional medicine are hand holding and they go down the path together. It is not something that you can separate out. And then last but not least, on that immune and disease prevention, sleep. You cannot get away from sleep. There are 5 pillars to health that you have to optimize. Number 1 is sleep. Number 2 is nutrition. 2 and 3 you can intertwine. If somebody's overweight, movement is probably a little more important than what the nutrition is if they have high insulin, because your large muscle groups, those things are independent glucose sinks, which allow the insulin levels to lower. So they're kissing cousins. You can't separate those two. They are too intimately entwined. So you've got to get to it. Now here is in the functional medicine biohacking realm where there is quite a big difference. And that's in the use of self-tracking tools. The biohacking community has a lot of self-tracking tools, just Oura Ring, Whoop, Fitbit, constant glucose monitors. Now, functional medicine practitioners do use the constant glucose monitors, but Oura Ring, Whoop, Fitbit, those types of things, functional medicine doctors, not all of them, some of them do, but they don't check them. We like to know what those are because then we can see how much movement, how much sleep are you getting. The Oura Ring is really, really good at looking at your sleep, reading heart rate variability, and telling you how stressed you are. The other thing to do that I do that biohackers do is looking at the genetics. Biohacking and some of the claims of genetics of the genetic providers. So when you're doing the 23andMe and you're doing DNA supplementation or whatever one you want to do, they're like, this is it. This is how your body reacts. It's a blueprint. It gives you a great outline of, hey, if you're doing these things, you have these SNPs. This is what the research says. If you allow these SNPs to actually express themselves, this is what will happen. Perfect case in point. Everybody knows celiac disease. They can't touch gluten. And that's a dysfunction in the HLA, DQ2 and DQ8. One of them's a DQ, one of them's not. I know it's a 2 and an 8, and they're together on the forms. I know that if a person is eating the standard American diet, getting lots of gluten, that they will have non-celiac gluten sensitivities if they have either the 2 or the 8. If you have both of those, 2 and 8, then that is one of the confirmatory diagnoses for having celiac disease. But if you just have one or the other, they don't think much about it. But once again, getting back to the functional medicine and diagnostic testing, when we do the DNA testing, DNA is not your destiny. There are people out there with um, the APOE3/4 genetics and the APO4/4 genetics, and they don't have Alzheimer's, dementia, or any neurodegenerative diseases. What's the difference? The environment. The environment pulls the trigger. So I don't. I put weight into those things because a lot of people come into me with problems already, but it doesn't mean that we also can't shut those things down. That's what functional medicine does. That's what biohacking wants to do. It's wanting to shut those things down. So what those devices and those tests give you is they give you data with which to act upon. So when you see that, now you can start to make changes according to the data you have and see. Everybody is an experiment of one. Everybody is an N of one. You have to go through life basically doing things and testing things to see what affects you. If you're pretty ill, pretty sick, pretty inflamed, everything's going to affect you. But if you're not, and you have taken the time to start to build resiliency back into your system, then you're not as susceptible to these problems. If you keep chipping away at the foundation, yes. But just like for me, I have the APOE3/4 and I also have the HLA DQ2 genetics. So if I sit there and I am eating lots of breads, I'm eating lots of nutrient devoid foods but have lots of gluten in them, I will start to have reactions. Your body gives you hints before it just breaks down. We like to take those hints and medicate them with anti-inflammatories and cover them up with analgesics, painkillers. And then that way we can go about our happy dappy life and think that nothing's going to happen to us. But now we've seen long enough, we can look at our grandparents and our parents and we can say, ah, if I continue down this path, then I'm going to end up just like you. And I don't want to do that. So by my dad was a big man, love him to death, gentle giant, super nice guy. But by the time he was in his 50s and 60s, he was banking on 300, 350 pounds. I'm not there. I don't ever want to be there. And it is a struggle. So I got to watch all of these things. So now let's talk about what functional medicine and biohacking do very, very well. And that's boosting your longevity through lifestyle design. If you take all of those components of the brain and focus, cellular health, inflammation control, hormones, metabolism, immune function, and what's the other one? Longevity. If you start to look at those things, look at the tests, look at the data you get, you can start to actually form a life and habit chain that allows you to optimally live. And it's just like this week. Things are starting to happen. We've had flooding in Columbus. So my morning routine, which is typically wake up, I do a heart rate variability test. I will go do a cold plunge. I get my vitamins together. I do all of this stuff. And then I'm generally in the clinic by about 6 o'clock. I do my run, lift my weights. That's all gone out the door because Gracie's doing e-learning and our house has really crappy internet. So she comes here because we've got blazing fast internet. She comes here and that just kind of changed that because I don't want to wake her up at 4:30, 5 o'clock in the morning. Not really fair to her, and I can catch up later. So you can start to form that type of lifestyle for yourself, no matter if you're a third shift worker or what the case may be. You start to maintain the frame, maintain the body so that it works optimally for you. So that's the ultimate goal. And that's why, like our functional medicine patients, I've been doing this for a long time. Once we get their MSQs, their multiple symptoms, medical symptoms questionnaires down to where they like it. Generally, it's always below 20, and typically it's in the single digits. I have like 5 things going on. I might get a little stuffy nose or something like that, but that's where our patients get to. And when they get there, then we're like, hey, we'll see you in 6 months, or we'll retest in a year and let's make sure that things are continuing to go as you want them to. That's where you drive the bus. That's where we want you. It's not about, oh, hey, keep on coming in, keep on coming in, keep on coming in. That's not the issue. The issue or the case is, as Jessica says, we're trying to put ourselves out of business. The more people that we can teach to do this, they can go back and teach their families, and then they don't need us, and they are healthy, their family is healthy, and they get to live life like people used to live life. So, in the summary, biohacking and functional medicine are very intertwined. Functional medicine uses a lot of biohacking techniques and tools depending on your provider. Some providers do use the Aura Ring, some providers don't. Some providers use CGMs, some don't. I am hey, let's do what's best for you and get you to your goal the fastest. So talk to your functional medicine providers. Do they use biohacking? That's there's not really a difference. They are tools that intertwine, and ultimately, it's about you and about making you feel better, about giving you control of your health and giving you the ability to say, hey, I want to have a few drinks with my friends this weekend. How can I do that now at 50 and 60 and I get these mind-blowing headaches, or I have migraines, or I can't grip hard because I have arthritis? It's looking at all of these things and saying, let's really attack what's at the root of these things. And then if you want to go have a drink, you can have a drink or two, and you're not going to have the pain and the problems. You can go to a party and enjoy the cake and not have the pain and problems. That's the resiliency. Both biohacking and functional medicine work on resiliency to give you the ability to not only hopefully not get as sick as you normally are, because that's what most of my patients report. Hey, I've been with you now for a while. We just went through the winter. I'm usually always sick, and I didn't get sick once. I see that a lot. And that's what we want for you, because that's part of enjoying life. As I've joked with people before, nobody gets out of life alive. So you might as well enjoy it as much as you can. Does it take a little work? Yes. Is it complex? No. But it is work. And you may need to change some things. But ultimately, that's always up to you. How well do you want to feel? How much time do you want to spend with your family and friends and be functional? That's the ultimate goal. You all have a wonderful evening. If you need to contact us or if you have questions, reach out. drmiller@integratedhealthofIndiana.com. You can call the clinic at 812-346-1757 and talk to Tina and set up a 20-minute consult. We love helping people. That's what we're here for. We are doctors and nurses that are here to teach and to help you be the best that you can be. And that's how we help you heal from the inside out.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.